Hey everyone, this is Ty and Cole. So we did acai berry. So what is it? Acai berry is a small fruit that grows on acai palm trees and is similar in size to a grape. The seed makes up about 80% of the fruit. The seed can be used as a source of polyunsaturated and saturated fatty acids for livestock, or it may be used in soil. It makes up about 42% of the diet of the caboclo populations in the Brazilian Amazon. Aside from its uses in livestock feed, diet, soil, acai berry has been used in cosmetics, hygiene products, and most importantly, as a weight loss dietary supplement. So, who would use it? Acai berry has made a big come up in popular culture, especially starting in the 2000s. Unfortunately, almost none of the claims behind its beneficial health effects have been confirmed by research. One major company producing acai products made false claims that Oprah Winfrey endorsed it as a weight loss supplement. Since then, it has largely been seen as such. Therefore, those seeking to use the berry would most likely be using it as a weight loss supplement, which would include athletes or anyone trying to lose weight. However, to this date, there is no scientific research that suggests any weight loss benefit to supplementing acai berry in one's diet. Typically, websites that list the potential health benefits of acai berry will briefly note that more research is needed to validate the claims. So, what are the effects of acai berry thought to be? Aside from being largely promoted as a weight loss supplement, the following health benefits claims have also been made. Acai berry has been said to help treat arthritis, improve health as an antioxidant, reverse diabetes, expand the size of the male genitalia, increase sexual virility, improve digestion and heart health, boost immune system, and increase energy levels. So, side effects, adverse reactions, and warnings. Drinking raw acai juice has been linked to outbreaks of American trypanosomiasis and Chagas disease. Other side effects may include gas, nausea, bloating, constipation, and loose stool. Since acai berry extract has inconclusively shown to reduce blood sugar, one should use caution if prone to bouts of low blood sugar or if taking a medication used to control blood sugar. Also, its high potassium content warrants caution for those following a low potassium diet.
So, are the effects similar to another drug? Some of the anti-inflammatory effects of acai act on the same pathway as NSAIDs. The antioxidant effects are similar to many other berries. It possibly has a similar effect to insulin drugs, as acai berry extract has been shown to decrease blood sugar levels. Additional claims in relation to similar effects to drugs cannot be made, as much of the research on health effects of acai need to be further investigated. So, overview of studies and the popular opinion on it. Frozen acai pulp taken twice a day for 1 month has been shown to reduce fasting blood glucose. In laboratory research, constituents of various formulations of acai have displayed anti-cancer effects. A study done on rats with acute renal failure showed that acai berry has a potential role in ameliorating renal damage. A study done on isotonic beverages found that significantly higher antioxidant and biological effects were determined in new blends such as acai, maquis, blackthorn, and chilinus in comparison with commercial isotonic beverages. Study done on the safety of acai drinks studied dosages as high as 20,000 milligrams per kilogram of body weight in rats and found that the results provide an additional experimental evidence that acai berry juice is non-toxic. Another study found that the presence of acai extract in cigarettes had a protective effect against emphysema in mice, probably by reducing oxidative and inflammatory reactions. These results raise the possibility that the addition of acai extract to normal cigarettes could reduce their harmful effects. And acai berry has shown no effect on behavioral modification. So as far as recommending it to a family member, acai berry and acai berry products have been shown to be very safe throughout the research. Possible instances when they should be avoided include low potassium diet and in people with low blood sugar. They can possibly have an additive effect with low blood sugar lowering medications because of its blood sugar lowering properties. They should be avoided if prone to bouts of low blood sugar. I would recommend this to a family member. There are documented benefits such as antioxidant properties, reduces blood glucose levels, and anti-inflammatory properties. More research needs to be done on this as a whole, especially those, but acai berry represents a healthy choice with minimal risk. It may not have all the benefits that it claims to have, but it has properties similar to many other berries at the least, and it can have much greater benefits if the research shows that in the future. And these are our sources.